There are two phases during ventilation: inspiration and expiration. We're going to begin with inspiration, and we're going to start by looking at quiet inspiration. This is normal, quiet breathing. The respiratory volume that comes in during quiet inspiration is equal to tidal volume, which is 500 mils. During quiet inspiration, the diaphragm, which is a dome-shaped muscle, when it is relaxed, will contract and flatten, moving down inferiorly. The external intercostals, which are located between the ribs, will contract, pushing the rib cage out and up. Both of these actions will end up expanding the thoracic cavity, increasing the volume. As soon as you increase the volume of the thoracic cavity, the intrapulmonary pressure will decrease. Thus, atmospheric pressure will become greater than the intrapulmonary pressure, the pressure within the alveoli. So when does air flow or gas flow stop? Remember, when equilibrium is reached, when atmospheric pressure and intrapulmonary pressure are the same, when both of them are 760 millimeters of mercury at sea level. Another type of inspiration is forced inspiration. This is when you take a deep breath. Forced inspiration can occur during vigorous exercise or in an individual that has a pulmonary disorder such as COPD. During forced inspiration, additional muscles will contract, increasing the volume of the thoracic cavity even further. When this occurs, the pressure in the lungs, the intrapulmonary pressure, will decrease to a greater extent, increasing the pressure gradient. The larger the pressure gradient, the difference between the atmospheric pressure and the intrapulmonary pressure, the more air has to come in until equilibrium is reached. The muscles involved in forced inspiration, the additional muscles, are the scalenes, the sternocleidomastoid, and the pectoralis minor. The second phase of ventilation is expiration. Let's begin with quiet expiration. Quiet expiration is considered a passive process. This is because it does not involve muscle contraction. The inspiratory muscles simply relax. The diaphragm, when it relaxes, it returns to its dome-shaped position. When the external intercostals relax, they move the rib cage back down. Both of these actions are going to decrease the volume of the thoracic cavity, resulting in an increase in intrapulmonary pressure. As soon as the intrapulmonary pressure is greater than atmospheric pressure, air moves out until equilibrium is reached. Remember, the intrapulmonary pressure only has to be 1 to 2 millimeters of mercury higher than the atmospheric pressure in order for a pressure gradient to exist. Once both pressures are equal to one another, flow stops. So during this process of quiet expiration, atmospheric pressure will be less than intrapulmonary pressure. Forced expiration is an active process because it involves the contraction of some expiratory muscles. The contraction of these muscles are going to decrease the thoracic cavity even further, thereby increasing the intrapulmonary pressure to a greater extent. So here you might increase the intrapulmonary pressure to 3, 4, even 5 millimeters of mercury higher than atmospheric pressure. The muscles involved in forced expiration are the abdominal muscles and the internal intercostal muscles. The abdominal muscles, such as the obliques and the abdominis, when they contract, they compress the abdominal cavity. This pushes the diaphragm superiorly. In doing so, is going to decrease the thoracic cavity. The internal intercostals, when they contract, they pull the rib cage down even further, again decreasing the thoracic cavity. Both of these actions will lead to an increase in intrapulmonary pressure, providing for a pressure gradient so that air moves out of the lungs. This pressure gradient will be greater than what occurs during quiet expiration.